Now that you've finished the initial survey and evaluation, let's get started on the course. The first thing we need to do is explain to you the basics of the CT scan and what exactly you're looking at on the computer. As you know, a CT scan is a three-dimensional image of the face in this example. It's then separated into different cuts in three views: axial, sagittal, and coronal. In an axial view, we're looking at the face from top to bottom in different cuts. This means that in the axial view, we'll start at the bottom of the face below the jaw and move upwards towards the top of the skull. Next, in the sagittal view, we're viewing the cuts from side to side, from left to right. This means you'll end up starting on one side of the patient's face and going deeper and deeper towards the middle, and then going out laterally towards the other side. Finally, in the coronal view, you're starting outside the patient's face and going deeper and deeper into their face. This is a front to back view. Okay, now let's jump onto the computer into a DICOM viewer to show you exactly what I mean when it comes to these three views. Now that you understand the basics of the three views of a CT scan, let's look at them on a computer screen. For the purposes of this course, I'll be using the PACS IntelliViewer to show CT scans. However, you can use any DICOM viewer that you find on the internet or that's included with your university hospital program. PACS IntelliViewer is what we use at McGill, so for that reason I'll be using it to show you everything on this course. The first thing you want to do when pulling up a CT scan is look at the millimeter thickness. For the purposes of this course, we'll always be looking at CT facial bone scans, and these are dedicated CT scans of the face so you can analyze the facial bones and soft tissues. It's what you'll always want to use to analyze for facial fractures. The millimeter thickness indicates between each cut of the CT scan what is the distance between slices. For example, in this image we see 1.25 millimeters. This means that every time we scroll, we're going 1.25 millimeters higher. In contrast to that, if I pull up a 2.5 millimeter scan, for example, you'll notice as I scroll that the distances are larger, and thus it's hard to appreciate fine detail and analyze properly for all fractures. At the very minimum, you want to look at a scan of 1.25 millimeters, but the lower the number is, the better. In an ideal world, you would always look at CT facial bone scans of 0.625 millimeter thickness. For this video, we'll look at one with 1.25 millimeters. As we discussed before, there are three views you want to look at: axial, sagittal, and coronal. The most important thing is to have a systematic routine that you follow every time you analyze a CT scan. This ensures that you won't miss any fractures, and if your approach is the same every time, you develop a routine that becomes quicker and faster, and soon you'll be able to analyze scans in a very rapid but efficient manner. Let's start off with our axial view, and I always like to approach it from a bottom to top. This means that as you're scrolling up in your axial view, the first structure that should come into view is the inferior border of your mandible. Keep in mind that the axial view is the best view and most important view for visualizing almost all facial fractures with a few exceptions. In future modules, we'll go over great detail looking at the mandible, the maxilla, and all the other bones of the face to analyze for facial fractures and what you'll be looking at from an axial point of view. Now, if we move along to our coronal view, I always like to approach this from an anterior to posterior direction. As you can see here, the vertebra and the spinal processes are beginning to come into view. I immediately scroll to the other side so that we can always approach the face from an anterior to posterior point of view. As you can see here, the first structure that will come into view is the soft tissues of the nose. And as we continue to scroll, we'll see all the different structures of the face from a coronal point of view. You can already begin to appreciate that the coronal view will be very good to detect orbital fractures, as it shows all the bony walls of the orbit, as well as a great view of the orbital floor. Finally, our sagittal view is used to view the face from a left to right direction, or a right to left direction. It's difficult to tell which side you're on, and the easiest way to correlate is to pull up two views. For example, if we pull up our axial view at the same time, we know that on a scan, this side is the right side of the patient, and this side is the left side of the patient. All viewers usually have a 3D cursor button here, so if you click in one area on one scan, it shows the corresponding area on the other views that you have pulled up. So, if we have our axial scan here, and we click on the right side, we immediately know that this is the right side of the patient. We can then scroll through the scan, knowing that we're starting on the right side and progressing towards the midline and then to our left side. Finally, one point I want to discuss is making sure that you're always looking at the right window. What I mean by this is CT scans have built-in preset windows that can be used to view CT scans. For example, if we're on the head and neck window, although you can see similar structures, you can begin to appreciate how hard it is to see the fine intricacies of the bones and look for fractures. For example, let's start out with our bone window, which is the window we should always be on. Here you can see a bilateral comminuted nasal bone fracture. And if you're not sure how to identify that right now, don't worry, we'll be going over it in detail in our nasal bones module. The bone window is always used to diagnose facial fractures, as it provides our best opportunity to view the details of the cortices and look for possible breaks. If, for example, we're on the lung view, you can immediately tell how difficult it is to analyze the bones of the face. Now, although this is very obvious that you may be on the wrong view, other ones, for example like the head and neck or brain windows, might be more subtle. For this reason, the first thing you want to do when pulling up any CT scan is to immediately switch the view to the bone window. On this viewer, it has a hotkey of F7, and most viewers will have a hotkey that you should immediately press whenever pulling up a CT scan. Finally, whenever looking at any kind of fracture or anatomy or something you're not sure about, you should always look at it from multiple angles. For example, let's say you weren't sure that there was a fracture of the nasal bones on this image. By pulling up a second view and using your 3D cursor, you'd be able to analyze those bones in a different view and be able to correlate and realize that there definitely is a fracture. You could even pull up 3 views and look at all 3 views at once. So, to conclude, the most important thing when it comes to the basics of viewing a CT scan are to follow the same routine every time. This includes not only looking at all 3 views, but making sure your approach is a general approach and then looks at all possible facial fractures for every scan. Secondly, you always want to look at the millimeter thickness on this viewer shown on the image and pick the lowest possible millimeter thickness you can. Finally, always make sure to set a scan immediately to bone window whenever viewing it to view for facial fractures. This concludes our video on the basics of viewing a CT scan.